guys, welcome to another episode on Nurse Next Door _ online nurse page. I'm Vicky, your host, and today we'll be talking about a very popular topic, menstruation and menstrual cycle. Now, this topic is popular because at one point or another, every one of us must have heard a thing or two about menstruation and menstrual cycle. Some male folks might feel like, well, this topic is not for me. Well, it is. Not because you'll be experiencing menstruation, but because knowing about menstruation and menstrual cycle would help you to understand what your wife, girlfriend, sisters, or significant other go through during their menstrual period. What is menstruation? Menstruation, simply put, is a period of the month when there is blood flow from the vagina as a result of hormonal changes, which causes the buildup of the lining of the uterus or the womb to shed. Actually, what happens in the woman's body before the blood flow is that luteinizing hormone and follicle stimulating hormone is released, which then stimulates the release of an egg. After the egg is released, estrogen and progesterone is released to help the lining of the uterus or the womb to build up, making it ready for the fertilization of the egg. When the egg is not fertilized, estrogen and progesterone level will be reduced. This reduction will stimulate the release of prostaglandins, which will make the walls or the lining of the uterus or the womb to undergo involuntary contraction, and blood supply will be withdrawn. After the withdrawal of blood supply, the walls or the lining of the uterus or the womb starts to break down and shed. This is basically how menses occur. Now let's talk about premenstrual syndrome. Premenstrual syndrome are those symptoms a woman experiences before menstruation occurs. They include depression, moodiness or mood swing, vomiting or nausea, headache, anxiety, irritation, cramps or pains in the abdominal region, mostly the lower abdominal region, change in appetite or loss of appetite, diminished libido or decreased sex drive, muscle spasm, fainting, heart palpitation, minor vision problem, pimples, bloating, allergies, decreased coordination, and a whole lot more. I know a lot of us will want to know why some women actually experience cramps or pains during menstruation. Well, here's the reason. Earlier I mentioned prostaglandins, which helps the walls of the uterus or the womb to contract. During this contraction, a woman would feel pains. Also, when a woman has high level of prostaglandins, she would also feel pains prior to her menstruation. But this pain do not occur in all women. Like, not every woman feels pain. Some people feel mild pain, some feel very severe pain, while some do not feel pain at all during their menstruation. It all boils down to our different body systems. So if you feel pains during menstruation as a woman, it is normal. Do not feel abnormal at any point. It's totally normal. It's just your body system. And there are ways you can manage this pain. There are ways you can reduce or control the pain. How do you manage menstrual pain? Like I always preach, homemade remedies. Yes. I told you guys in the previous video that I would not be mentioning any drug because I'm totally against self-medication. You can relieve menstrual pains by applying hot towels or hot water bottles or hot pads on your abdomen. Then you can take hot Lipton tea or green tea. It helps relieve pains. You can also relieve pains by avoiding sugary, salty and fatty food during menstruation. Also drink as much water as possible and eat more of anti-inflammatory food like berries, tomato, cherry and all of that. Please avoid tobacco, alcohol, cigarettes and anything containing caffeine during menstruation. Also, chew ginger or turmeric, it helps relieve pains. And you can try mild exercise like squats, sit-ups, and strolls. It helps to relax the abdominal walls and also reduce pain. You can try massage. Yes, massaging the abdomen gently and also back rubs help to relax you, and a good sleep. Yes, try sleeping, take a nap. It will help to relax your body. Acupuncture and acupressure also help to relieve pain. Warm baths are very effective. Take a warm shower. It helps to relax your muscles. It's important to bathe with mild soap because during menstruation, some people or some women experience some allergic reactions. So please use a mild soap. How to calculate menstrual cycle? A lot of people get confused and find it difficult to calculate menstrual cycle. Here is how. Use calculate menstrual cycle by counting from the first day of your present period to the first day of your next period. For instance, if my present period started on the 1st of November and my next period in the next month starts on the 2nd of December, I would count from the 1st of November, which is when my present period started, to the 2nd of December, which is when my next period started. So the days interval or the days between the 1st of November to the 2nd of December is my menstrual cycle. Menstrual cycle could be between 21 to 35 days. It all depends on our body system. There is an important part of this topic, menstruation and menstrual cycle, I would want us to talk about, which is the color of the menstrual blood. As funny as it may sound, menstrual blood can come in different colors, and these colors indicates different things. A menstrual blood color could be black, brown, pink, orange, bright red, greenish, or gray. When a menstrual blood is black, it means that the blood has stayed longer in the uterus and it has had more time to oxidize. Also, when a menstrual blood is black, it could be an indication for vaginal blockage or vaginal infection. You can suspect vaginal infection if there is itching, foul smell, or swelling in the vagina. For a dark red blood or a brown blood, you can also say that it has stayed longer in the uterus and has also had some time to oxidize, even though not as much as the dark or black blood. For a menstrual blood that is bright red in color, it indicates fresh blood and consistent flow. In some ladies, the menstrual flow might start with bright red blood and end with a dark red blood or a brown blood, and in some other ladies it might start with bright red and all through it will just be bright red blood till the end. So it all depends on the individual. Then for the pink menstrual blood, the pink menstrual blood occurs as a result of mixture of the blood and cervical fluid. Also, the use of hormonal birth control pills can lower the level of estrogen, making the flow lighter or pinkish. Orange menstrual blood may also occur if the menstrual blood mixes with cervical fluid. Also, orange menstrual blood can be an indication that one has vaginal infection like bacterial vaginosis. So, if your menstrual blood is orange in color, you might want to see a gynecologist. A greenish or gray menstrual blood is a clear indication of an infection. So please, if your menstrual blood is greenish or gray, please see a gynecologist as soon as possible. It's important to note that sanitary pads used during menstruation should be changed 4 to 6 hourly. Do not wear a pad for a whole day. It's very bad. It's wrong. It could be a source of vaginal infection. At this point, we'll call it a wrap on today's episode. Please, if you have questions, suggestions, opinions, I would love to hear them. Please drop them in the comment section. Remember, self-medication is bad and your health is as important as wealth. Until next time, stay safe.